And I'm recording this so I can share it later. So if you want, feel free to turn your camera off. And I'll be taking questions at the end. So I'll bring up the chat box at the very end. I'll stop sharing my screen and bring up the chat box, and then I'll take questions. This webinar will go about an hour. So if you need to leave early, feel free to. Get started really soon here. Let's wait one more minute to see if anyone else joins, and then we'll get started. All right. Thanks for coming, everyone. Thanks for joining me in this webinar. This is how to run after pregnancy. So hopefully that's what you signed up for. You knew you were in. Let's get started. I just want to introduce myself. My name is Michelle Tucker. For those of you who don't know me, I am a certified personal trainer, and I specialize in pre and postpartum training, as well as women-specific training. I'm an owner of The Strong Mama. That's my own business where I do my training. And I've been a trainer 7 years now, and I've specialized in pre and postpartum for that long. Jumped on that right out of the gate. I'm also a mom of 2 little boys. You can see in that picture, I've got Lucas there on my left. He's my 7-year-old, almost 7-year-old. And then my 3-year-old Dylan is in the middle. I love my family with 2 little boys. We're very active. So we love exploring the mountains, being outside. You can see we're all there in that picture, playing with my boys, traveling with my husband and my kiddos. And then I also just love on my own. Jogging and running is a really great release for me. So I love to do that on my own and with other people too. So I've been a runner almost my whole life. So this is definitely a passion of mine. So for right now, we're like a lot of people. We're quarantined, we're at home. And we opted to do virtual schooling for my 7-year-old. So I've been doing that all year with him and learning how to do that. And my 3-year-old's been right with us in that. My husband's been working from home. So I feel like we've all just been around each other a lot, which is really great. As well as for my business I had to put on hold for a while, trying to figure it out because I do training in person, but not being able to do that with COVID and still learning how to navigate that. I've been figuring out how to do everything virtually. So that's been a big learning curve for me. But I'm figuring it out. I was already trended toward the virtual scene with moms. As you guys know, it's just hard to get out of your house. So I was already learning how to do that. And now even more so, writing programs for online and doing training. I've been doing a lot of Zoom training lately. So that's been really fun to figure that out and really good for me to get that push. So that's where my life is currently. All right, what are we going to talk about today? So I just want to go over our timeline for what we're talking about. So we'll start with a timeline of when to begin running after having a baby. I'll go over what exercises you can do to prepare the body for running, and I'll have exercise examples later in the presentation. And for each of you, you're going to get emailed a copy of some exercises and other things you can do to ease into running and progress your running after having a baby. I've got a handout I'll email to each of you. It's got some of the ones I include in this presentation, and then this presentation has some ones I don't include in there. So a little bit of both, but something you can walk away with. Also, how to know when your body's ready to begin running, how to begin running, exercises to progress your running and how to progress your running. And that's also I've got some women attending who probably are already beginning to run. So how to keep going with that. And last, when to connect with a professional for more help, if you need more help, and questions at the end. All right, so first of all, for my timeline, this is a pretty general timeline that I use. I've seen variations of it with different professionals. And obviously, this is a very personal thing. So it depends person to person. I've had clients start running as soon as 3 months postpartum, but They're being cleared by me, they're being cleared by other professionals and being watched carefully. And it really just depends on the woman. Each woman's body responds to pregnancy differently. They respond to postpartum differently and heal differently. So you just play it person by person. But this is I like this timeline. I use it for my online programs. I have one called Ready to Run, where I walk women through easing back into running. And I've had several clients go through that program and find this timeline really helpful and really great for them as runners and for women who are postpartum. So first of all, baby's born. Up at the top, this is a time for healing and rest. I can't emphasize this enough. So we call this the fourth trimester, those first 3 months after baby is born. And it's really healthy to look at it that way. Your body has just been through 9 months of change, which is a short time to go through as much change as it goes through. And then birth on top of that, whether it was vaginally or via C-section. And so this is a time just to heal and just to rest and to make that a top priority. Sleep as much as you can and let the body just recover. And then around 3 months with my clients who I'm working with, we'll sometimes work on core before 3 months, but definitely we start to focus more on core and posture. And core includes the pelvic floor. So we start re-strengthening the core intentionally, re-strengthening the pelvic floor, working on getting your posture back to what it was before you had a baby, because our posture changes a lot over pregnancy. Certain muscles lengthen, certain muscles tighten. And so getting that back takes a bit of intention and a bit of time. And it's really important for running to have good form and posture. And then at 4 to 5 months, we start some strength training, and that begins with basic body weight training and some resistance bands. And then we progress that. And strength training is really important. You need to be strong to be able to run. And it's easy to lose a lot of that muscle memory and muscle mass during pregnancy and postpartum. So we start to work on that. And then at 6 months, we begin our jogging intervals. So 6 months sounds really late for a lot of people. It feels like a long time to wait. But I found it to be a really good time for several reasons. Like I mentioned earlier, it takes a while for the body to heal after pregnancy and postpartum. There have been studies done that have shown it takes a full 3 to 6 months for the pelvic floor alone to heal from a vaginal birth. And even if you don't have a vaginal birth, your pelvic floor has been stretched throughout pregnancy. So it needs to recover and regain its integrity and re-strengthen. So first of all, there's the healing phase of it. But then on top of that, you're not sleeping a whole ton with the newborn. So having those 6 months to get back to sleeping, to get the hormones to balance out a little, all those factors included, 6 months sounds like a really great time to start jogging. And if you're using a stroller, it's not usually recommended to begin jogging with baby in a stroller until they're about 6 months anyway. So that just works together really well for all my moms. And notice I put in there intervals. We start our jogging intervals, and I'll talk about this more later, but it's a jog walk type of program. And then at 9 months, we progress our strength training. We add a lot of different kinds of strength training, and I'll go over those, and progress our jogging intervals more. So we're jogging more and walking less. And then something we don't talk enough about, but around 12 to 18 months, moms start to feel normal again. It really does take that long. So if you're pregnant or you have just had your first, this might be a surprise, but it really does take a while to start to feel normal, just with hormones, with sleep, with healing. And it's good to know that if you do experience that, that's okay. You're in the majority. All right, so how do you prepare to run? Because we've got all those months leading up to running, and there's definitely a lot you can do proactively to set your body up for success with your running when you're ready. So first of all, I mentioned earlier, you want to allow that pelvic floor to heal and re-strengthen. Your pelvic floor muscle, if you don't know this, they're your muscles that sit at the bottom of your pelvic bowl. So you've got your pelvis like a bowl, and they sit at the bottom. And they support everything in there. They support your organs. When baby's growing, they support baby as baby gets bigger. And so they've been through a lot. We've talked about that. But also when you add in impact running, impact exercises, they bear the brunt of that impact. So all the impact goes straight to the pelvic floor, that pressure down on it. So it's a lot for those muscles to handle. And if they're not ready to handle it, they won't handle it well. So it's really important to heal and re-strengthen that. And then re-strengthening your core with that, your abdominal muscles, because they work together. And your core is the powerhouse of your running. When you think of running, you want to think of your core being that powerhouse. So re-strengthening the core, and that includes addressing if you have any ab separation. That's called Diastasis Recti. I'm not going to go a ton into ab separation, but finding out if you have it, you can get assessed. You can assess yourself, but you can get assessed really well by a doctor or a physical therapist. And if you do, addressing it, finding ways to help it heal and help it get better so that your core is working really well when you're running. Along with that, resistance training. I mentioned doing that strength training before you're running, building up your muscle, building up your stability. So anything that assists the body in a lot of mobilization, the hips moving around a lot. You want to build up those muscles. Building up your cardio base. I have my clients who I'm getting prepared to run, I have them walking several times a week for good amounts of time because your heart and your lungs have to handle the running, right? And you can definitely work on your cardio before you're able to run. So you can walk. Walking is amazing, and it's such a great form of exercise. You can also do other low impact cardio, such as cycling, biking, swimming, row machine, elliptical. Any of those are great ways to work on your cardio without adding that impact in there yet. And then we work on unilateral and impact movements. So unilateral basically means working one side of the body at a time, because running is a one-legged exercise. You've only got one foot on the ground at a time. It requires a lot of balance and stability of the muscles and both sides to work well. If one side isn't working well, it's going to throw the whole body off. So unilateral strength training, where you're working one leg at a time and one side of the body at a time, helps address that and helps prepare you for that. And we'll go over some examples of those in a bit here. And then impact movements. This is important because you want to teach the body how to handle impact before you begin running, and how to do it properly. And that's something I work with my clients on. And impact movements can be anything from stepping to jumping to running. And then you want to get clearance from your doctor, of course. So you're going to get clearance to exercise anyways. But you also, I really, really encourage my clients to get clearance from a pelvic floor physical therapist. Every postpartum client I work with, I strongly encourage to just make an appointment with a pelvic floor PT for an assessment, whether they're having concerning symptoms or not. The main reason for this is pelvic floor muscles not only are super important and have been through a lot, but they're just hidden and we just can't see them. And so having someone who can actually check them out and see how they're doing and let you know how you're doing goes a really long way. And the clients I've had who do that just set themselves up success with their training and with their exercise, and really for lifelong. So that's been great. So how do you know if you're ready to run? Well, a couple of check marks. So pelvic floor healing, we've been over that. Are you symptomatic? Are you having leaking? Are you having a draggy heaviness a lot? Is your pelvic floor feel tired or painful? Any of those things, you'll want to check out why that's happening and make sure you find ways to alleviate it before you start running. Regaining of posture. Do you have good posture? Can you stand up straight? Can you run tall, walk tall without, your posture falling after a couple of minutes? Do you have good core strength? Have you addressed that diastasis recti if you have it? Comfort and energy, that's a big one. We don't talk enough in the US about how after you have a baby, you're not really meant to just jump back to life at 6 weeks, believe it or not. And a lot of us don't feel like we jump back to life. So is your baby sleeping enough that you have the energy to run? Are you getting enough sleep? Are you feeling well? Are you healing well? Adding adding a really taxing exercise like running onto your schedule, if you're already just burning both ends of the candle, can be detrimental. It's not always. There's kind of a give and take here, because I've had clients where running actually helps them sleep better and helps them eat better and helps them manage their stress. And then I've had clients who are already walking that fine line and adding something like running that adds toll to the body and energy system just kind of is too much. It can throw hormones out of balance. It can put you on the edge of chronic fatigue. So something to be aware of, not to scare people, but just something to be aware of. Is running the best thing for you right now? Or can you wait a little longer and wait till life settles down? Strength and balance, having those muscles that are nice and strong to stabilize the body during running and having the balance to handle it. Your joint strength, making sure you're not getting a ton of joint pain when you're adding in impact, and the ability to handle impact. So I use the impact exercises kind of as my way to see if my clients are ready to start running. They give me the green light or the red light on how their body is handling it. So those are all things to be aware of. And sometimes sorry, I'm going to go back. So sometimes that handling the impact and the joint strength, knowing if you're ready, it's just going to take trial and error. So if you feel like you're ready to run, you feel like you've built up a good base and a good foundation, and you've given yourself enough time, just try it. Just try jogging for a little bit and seeing how it feels. I would encourage you not to just see how it feels that day, but see how it feels the next day. Give yourself a day between trying and see, how your muscles, how your joints, how you feel. All right, so you're ready to begin running. How do you do it? So like I mentioned earlier, you want to build up that cardio base first of walking. So you're going to be walking 30 to 45 minutes several times a week. That's what I have my clients work up to. Obviously, they don't start out doing that right after having a baby, but we work up to that so they can have a great cardio base. And then we add in some jog walk intervals. So we start with maybe 20 seconds of jogging and a minute of walking. And we do this for about 10 to 15 minutes. Or we can do more minutes of walking. We just see how it goes. And the intervals I've mentioned earlier, they're really important because it's been shown by several studies that having that active break between the jogging intervals allows all the muscles to take a break, to relax a little. It allows your breathing to come down. It allows just the pelvic floor to engage a little better if it's got those breaks in between the working intervals. And it just goes a long way for people getting into running, whether they've had a baby or not, and build a stronger base rather than just going out and running a mile and seeing how your body does. It really goes a long way. Can't say enough about the intervals. So, and there's different apps out there. There's I think it's a Couch to 5K I've used before that have these kind of intervals. The only thing I'll say about the apps is I think you should use them, but also personalize them. So if they're having you progress and your body is not feeling ready to progress, then basically do what your body needs to do. Don't just follow the program to a T because it's built for many people. So then we're going to increase your time of the working intervals. So we're going to increase that jog from 20 to 30 seconds. And then we're going to decrease the time of your walking interval. So less walking, more jogging, to the point where you're jogging almost the whole thing, no matter how long that is. And then if you want more advanced goals, we'll increase the speed and distance of the run. And at the very end, set a goal. So my clients who do the Ready to Run program, I take them through several months of training. And then at the end, I usually have them sign up for a 5K or something else they can do. Although this last year it was hard to find 5Ks to do, but I have them sign up for something to do just to keep their motivation going and that they keep running and keep progressing in their running. So if you're already running, how do you progress your running so you continue to get better and stronger? Well, really important, those unilateral exercises are key. Anything that's single leg challenges balance. Also focusing on the hip, glute, and core strength for your running. Power movements and impact training, that's jumping, lunging, landing. and continuing to work on that for your running to make it more powerful and make you better at it. And then super important, release and rest days are vital. And I am huge on this with my clients. I schedule in their rest days for them to make sure they're taking them. And I have an app for my clients where I can see what they're doing and what they're not doing. And I check to make sure they're doing their rest and release days just as much as their working days. Not only because the body needs recovery, but because that's when muscles are built. Muscles are built in the resting time. And then also release. We have a lot of stretches, a lot of release techniques of the muscles to help after running. All right, let's get to the exercises. So some exercises you can begin doing even now. These are beginning exercises. These are my favorite. So I don't have a ton here. There's obviously a lot more you could do, but I've put down kind of the traditional ones or my favorite ones. So to begin with, squats. And here in this picture, I'm doing a squat to sit is what I call it, or a chair squat. And I like to have people start out with this so they're learning proper form of the squat. So a squat, you're sitting back as if there's a chair behind you. And I physically put a bench or chair behind my clients and have them sit back into it and then press back up. And that way they can feel how their spine's supposed to feel that use of the glute of the butt muscle. So squats are really great, good form with squats. Lunges are awesome. Lunges are good for teaching balance. This is a stationary lunge, and I start with those rather than walking lunges, forward lunges, backward lunges, for a couple reasons, but it's really great for teaching the pelvic floor how to activate with the core. And it requires a little less stability because you're just staying in one spot, but it really works the thighs and the hips. So it's really, really great. So lunges are awesome. Deadlifts, if I was to pick one exercise that is my favorite for postpartum clients, for women who've had a baby, it would be the deadlift. I just think deadlifts are magical. First of all, when done correctly, they strengthen such great muscles for regaining posture after having a baby. They also are just super practical for life. If any of you follow me on social media, you see me post about how important deadlifting is for everyday activities, for moms, but anybody really. And if we learn how to do it properly, we can save our back for the long run and save our joints for the long run. But to get into a deadlift, to learn how to do a deadlift the right way takes a lot of work. And so I start with this hip hinge over here just to the left and teach that so that you learn the proper form for a deadlift. So this is a dowel hip hinge. And what I have people do is that's a broomstick pull, but any long pull along your back, and you've got your 3 points of contact, your back of the head, back of the upper back between the shoulder blades, and then the tailbone. And you keep those 3 points of contact and you press the hips to the wall behind you, press them back as you rotate the upper body forward, keeping that aligned spine. And that will teach the body how to keep, first of all, correct posture in the spine during the deadlift, but also to rotate forward with pushing the hips back. And what that does and what a squat does is they lengthen the butt muscles, they lengthen the glute muscles. And that goes a really long way for helping balance out muscles for core engagement and pelvic floor engagement. And it's just really great for strengthening the glutes because any muscle you want to strengthen, you also have to teach it to lengthen. It's really important. So those are my beginner exercises. These are my core exercises. So core, like I said, powerhouse of your running, super important. And you can begin doing a lot of these in early postpartum. Single leg reaches is one I begin with. So you're on the ground on your back and you're going to be working the lower abs a lot in this. So you're going to bring the legs up into a tabletop position where the calves are parallel to the ground and you're going to engage those lower abs. And first, I just have clients learn to hold that and keep the lower abs engaged. And then we're going to progress that by lowering one leg at a time or reaching it out and keeping the lower abs engaged. And I have tons of information on my social media on lower abs and how to engage them and core stuff. I have a lot of Diastasis Recti and core stuff, and I'm happy to share that with anyone who wants it. So feel free to reach out to me if you want to know more about that, and I can email you some stuff or point you toward some of my things on YouTube and other social media networks where I have information on it. And then kneeling core rotation. So it's kind of hard to see in this picture, but that's a resistance band I'm holding, and it's looped around a low base. And then I'm in a kneeling position, a half kneeling position, and I've got a straight spine. I got nice tall posture, and I'm rotating over my outer knee with that resistance band. So that's a rotation, a core rotation. And this is great. The half kneeling works the hips, it works stability, it works the core, that rotation. And I'm really big on training in rotation and anti-rotation with the abs. So anti-rotation, in the handout, you'll see an exercise called pull-off press. And I encourage you to Google what a pull-off press is and watch people do it. But a pull-off press is working the anti-rotation. You're holding that resistance band out in front of you and trying not to rotate back towards your base. And these are just great for runners because there's a lot of rotation in running, but also they're great for runners who use strollers, AKA moms. So there's just a lot of work in the core with anti-rotation and rotation when you're running with a stroller. So that's another one. And then planks. Planks are amazing. I love planks. However, you have to be very careful getting into planks after you have a baby because those ab muscles have been stretched. And especially if you have an ab separation, you don't want to put extra pressure on it and put yourself at risk for injury. So I ease my clients into planking. We start with a wall plank with their hands on the wall and make sure they can engage the core and keep it engaged without pooching out. Kind of, you've probably heard of coning, maybe. Coning is when the abs make a triangular shape because there's too much pressure out on the abs after pregnancy. So if you see that triangular shape in your abs, that's probably a sign you're not quite ready for whatever move you're trying to do. So first we start with wall planking, and then we go to elevated planking, maybe using a coffee table where their hands are on a coffee table. And then we move to modified planking on their knees. And then when they've done really well with all of those, we do a full plank. But once you're ready for a full plank, planking is great. I keep planking in all my running clients' routines, no matter how far along they are in their running. It's always a great exercise. And side planking is huge, and it does a lot for you that planking doesn't do because it works your side ab muscles, your obliques. And the core system works all together. So it's really important to strengthen each piece of it to have a strong, able core. Then lateral movements. So lateral movements are great to add into a routine if you're a runner or becoming a runner or going to become a runner, because running is just all forward motion. And these muscles need to be worked to help keep the stability in the hips, keep the stability in the body, and just make sure certain muscles aren't getting overworked. So lateral movements are great really for anyone because we do a lot of sitting, a lot of driving, and a lot of forward movements, but not a lot of lateral, but they're especially important for runners. Right here, I have a monster walk. This has also been called X walks or banded lateral walks. So I have a resistance band under my feet. I've got it crossed in the front to add a little extra resistance, and I'm holding both handles in each hand. And then I'm going to get down in a semi-squat. So just squat back a little, push the butt back, and I'm going to step side to side, or I'm going to step sideways one way and then back the other, keeping that semi-lunge position. You can also wrap a mini band, a mini looped resistance band around the tops of the knees and do this, or around the ankles and do it. Side lunges, lunging out to the side and pressing back into that hip or glute, really loading that glute. And side step ups. So just like it sounds, stepping up onto a higher base and really thinking in all of these, loading the glute, the butt muscle. And when I say loading, it's easier to know what I'm talking about when you're doing it. just really pressing into it and feeling that butt muscle engage. All right, so lateral movements and now unilateral movements. I've talked about these or mentioned them several times. So anything one-legged. So bridge exercises are great for runners because it works the butt. But then a single leg bridge where you're just pushing off of one foot at a time and really engaging that butt muscle. Single leg deadlift. So taking that deadlift and doing it one leg at a time, really making it a balance exercise. Split squat. This split squat, I've got my rear foot elevated on a little bench there. And this is great because it puts that front leg is doing a ton of work in this. And I can really focus on that butt and that thigh of that front leg, really doing the work and seeing how it's doing. And then single leg squat or single leg chair squat. So single leg squats are obviously, they're very hard and they take a lot of work to get to. So how I get my clients there with the chair squat is we start with the first chair squat I mentioned, where you're sitting back into your chair and pressing up with proper form. And then when we're ready, we lift one leg off the ground and do the same thing. They are sitting back into that chair. We have the chair because then when the muscles let go, they can just kind of plop down in it and then press back up on two legs. And then you can progress that by eventually being able to press back up on one leg. Another way to do this is with, if you've been at a gym and you've seen something called TRX bands, they're bands hanging from a cable type machine, like a base, and you can use those to get down into a single leg squat and back up because you can kind of pull on the handles with the rope. But if you don't know what TRX is, don't worry about it. These chair squats are just great and I love it. They're definitely hard, but they're a great thing to add to your routine and teach a lot. Another benefit that unilateral exercises have for you is that not only do they strengthen one side at a time, but they help you see those discrepancies in the different sizes and their sides and their strength. You'll learn really quickly which leg is stronger. And people who just start running and don't really work on those imbalances, they're usually putting a lot of force down on one limb. And that one leg or that one hip or that one foot will start to take the toll and they'll start to get injuries there. So it's really great to address those and work toward creating balance in the body before and while you're running. And I mentioned impact training earlier, so I didn't put pictures in of this, but some examples of power and impact training I do with clients. First of all, we start with step ups. Just putting your foot up on a chair or box and stepping up onto it. And then we move to jogging in place. So just jogging for like 10 to 30 seconds in place with proper form in front of a mirror and seeing, and in each of these, I'm teaching them the proper form when they're doing it. But I'm also, so a lot of times they're doing it in front of a mirror, but I'm also checking to see how does the pelvic floor respond? Do they feel really heavy and draggy or pain at the end? And how do the joints respond? And are they able to hold their form for this time? Is their core strong enough to keep them upright while they're doing it? We'll add in high knee runs in place sometimes, depending on the person. Lunge jumps, so that's when you're getting down into a lunge and then you jump and switch legs for your lunge. These are really hard, so we ease into them very slowly. We do a couple at a time because it requires a ton of stability to be able to do that and to do it properly. But I like the lunge jumps and I like the skater jumps. I'll tell you what those are in a sec, because these are where I can really work with clients on how do you absorb the impact properly. And you can talk about absorbing impact properly, but having them learn how to do it with their bodies is where it really translates. So lunge jumps, we work on that landing softly. So landing and kind of bending the knees and absorbing it with the glutes and not just keeping the legs straight and letting all that impact go right to the joints. So it's a great way to learn how to absorb impact before you get out and you run. And skater jumps are, so a curtsy lunge. It's a curtsy lunge with a jump. And I need to add a picture of that, but you can always Google them too, skater jumps, and you'll see all sorts of videos on them. But you're basically lunging with one foot diagonally behind the other, and then jumping up and switching sides. Skater jumps are really great, and box jumps. You've probably heard of box jumps where you're jumping up onto a box, but again, box jumps, I start with a very low step before we move on to higher boxes. And we work on, again, absorbing that impact, learning how to move the body through that impact movement without putting all the toll on the joints. Another thing we're working on with impact and power, where if you're doing this on your own, you want to think about, is your breathing while you're doing these impact exercises. So whether you're jogging in place or you're jumping, it's easy for people to hold their breath when they're doing something hard, or maybe breathe more shallowly, breathe more shallow. But you want to learn how to breathe through these exercises fairly rhythmically, because what happens when we hold our breath or when we hold that tension is it puts a lot of pressure down on the pelvic floor and out on the ab muscles, which you're already trying to heal and already trying to work. So learning how to breathe in your running is really important for your whole body and not just your lungs. So I try to work on that with clients during these exercises a little bit before we run, but then also when we start running, it's a great time for them to slow down, think about their form, think about their breathing, and think about how they're moving their bodies through this movement. All right. So that's the end of the exercises. I want to mention, so what do you do if you get to a point where either you want more assistance in doing this, or you see some red flags while you're doing it? You're having some movement pain or some injuries or just some symptoms that are kind of having you concerned. Here's some professionals you can connect with. Now, first of all, on the right, there's me. So I think it's really helpful to have training, coaching, or some kind of program you follow when you're getting back into running, having someone walk you through it. And I am not only a certified trainer, but a certified postpartum exercise specialist. So it's what I do. And I do offer one-on-one Zoom training. Right now, I have a couple spots I'm still able to take clients with. So that's something I offer. I also have some online programs where you're basically doing it on your own, and I'm tracking you from a less involved stance, but I am tracking you online and giving feedback here and there. And I have that set up on a website. There's also, we got over on our left, our pelvic floor health specialist. So I've mentioned, I think it's really important to get an assessment of your pelvic floor after going through pregnancy. And Sharon Petty is, I'm just going to say it, Sharon's the best that I know of. She's just amazing at what she does. However, there is a long wait list for her because she is so good at what she does. So she has a bunch of therapists in her office, and I would trust any one of them with my clients. I refer clients to her office all the time. And I've had several clients work with the different therapists and really like them. They're amazing. And they're really great people too. So obviously pelvic floor can be kind of a taboo subject, especially if it's your first baby, but they make you feel really comfortable, and they're just really great women and men, if there's men there. So they're at the UC Physical Therapy and Rehab Clinic. That's on Prospect and LeMay and Fort Collins, and you can look that up. You can also reach out to me, and I'm happy to pass on their information and address and stuff. And then Katie Larson is a physical therapist here in Fort Collins. And I love Katie. I trust her with all my clients. I refer my clients to her regularly and my friends because she's really great at what she does. But she's really great with any type of joint pain or movement pain, or even just if you need a little more help getting into your movement properly, if you've got some tightness on one side or whatever. And she works at Adams and Giddings Physical Therapy in Fort Collins, and she's off of Drake, kind of near Shields. So again, I can give you addresses and more contact info if you want that. Just feel free to reach out to me. All right, let me see. Where to find me. So if you don't know already, you all should know this is my email address because you've emailed me, but also my Facebook page and my Instagram are there. Feel free to follow me. And I didn't put it up, but I have a YouTube channel, and on my Instagram page in my profile is a link to my YouTube channel, but I record a lot of workouts. I've started recording a lot of workouts, getting into that. And I put up some information on my